Southport killer moved to £300,000 a year Broadmoor as public pays for therapy and rehabilitation. He will be treated as a patient rather than a prisoner. Axel Rudakubana has been transferred from HMP Belmarsh to Broadmoor Hospital, moving the remorseless murderer of 3 young girls from a maximum security prison into one of Britain's most sophisticated psychiatric treatment environments. Independent clinical assessments concluded that he could not be managed safely in prison because of a mental disorder, leaving ministers with no discretion to block the transfer under the Mental Health Act. Rudakubana remains detained under the life sentence imposed for murdering 6-year-old Bebe King, 7-year-old Elsie Dot Stancombe, and 9-year-old Alice da Silva Aguiar at a Taylor Swift-themed dance class in Southport. He must serve a minimum of 52 years, and is considered unlikely ever to be released, but the conditions in which he spends those decades have now changed substantially. Broadmoor transfer gives remorseless Southport killer therapy, activities, and rehabilitation. Broadmoor is not an open hospital, a hotel, or a route to freedom. It is a high-security institution with locked wards, constant supervision, extensive surveillance, and specialist staff trained to manage men considered capable of causing extreme harm. That does not alter the central source of public anger. Inside Broadmoor, Rudakubana will be treated primarily as a patient requiring care, treatment, and rehabilitation, rather than simply as a prisoner being punished for his crimes. The hospital provides individually tailored medication, psychiatric treatment, and psychology-based therapy. Patients can also receive education, vocational training, pastoral support, physical health care, and structured social activities. Broadmoor's modern facilities include spacious wards, secure gardens, classrooms, therapy areas, craft rooms, a cafe, a shop, a hairdresser, and access to dentists and other healthcare professionals. Activities can include sports, woodwork, pottery, arts and crafts, education, and occupational programs. Every element is presented clinically as part of recovery and risk reduction. Nevertheless, to families who have lost children and to a public that watched Rudakubana show no remorse, the contrast with ordinary prison conditions is impossible to ignore. At Belmarsh, he faced segregation, severe restrictions, and the constant danger of reprisal from other prisoners. At Broadmoor, he enters an environment explicitly designed to improve his well-being, increase his engagement, and maximize his opportunity for recovery. Why the transfer feels profoundly unfair. The argument against the move is not that mentally ill prisoners should be denied necessary medical treatment. The objection is that Britain's system appears capable of finding intensive, expensive, and highly personalized support for Rudakubana after 3 children were murdered, despite repeatedly failing to control him before the attack. He was known to police, schools, mental health professionals, local services, and the Prevent Counter-Extremism program. He had carried knives, researched mass violence, expressed a desire to hurt people, and accumulated an alarming history of behavior that should have triggered a coordinated response. The state failed to bring those fragments together, while Bebe, Elsie, and Alice were still alive. It has now assembled a multidisciplinary team of psychiatrists, psychologists, nurses, pharmacists, social workers, occupational therapists, and specialist clinicians around their killer. That is the moral contradiction driving the backlash. The resources that were fragmented, delayed, or unavailable when intervention could have protected innocent children have become comprehensive and compulsory once the murderer requires treatment. The law requires the state to keep even the worst offender alive and medically stable. That principle matters in a civilized country, but the system loses public confidence when the offender appears to receive better organized care than the public bodies ever provided to those endangered by him. The cost could rise by £240,000 every year. The estimated annual cost of keeping a prisoner such as Rudakubana in a high-security prison is approximately £60,000. A place in a high-secure psychiatric hospital can cost more than £300,000 each year. That represents an immediate additional public cost of at least £240,000 a year. 1 year of psychiatric detention could therefore cost roughly 5 times as much as 1 year in prison. If the £300,000 figure remained unchanged, and Rudakubana spent his entire 52-year minimum term in hospital, the nominal cost would reach at least £15.6 million. The equivalent prison cost at £60,000 a year would be approximately £3.12 million, producing a nominal difference of £12.48 million. That is not a firm lifetime forecast. Rudakubana could be returned to prison once clinicians decide that he no longer requires hospital treatment. Annual costs will change, and inflation would materially affect the eventual amount. The scale remains extraordinary. Broadmoor's wider high-secure service is supported by commissioning worth about £100.7 million annually, illustrating the specialist staffing, clinical infrastructure, and security required to operate it. There have also been other direct public costs. The Crown Prosecution Service recorded £36,247.80 in counsel and presentation fees by April 2025, excluding the unrecorded time of its internal lawyers, paralegals, and administrative staff. That figure also excludes policing, forensic work, court operations, legal aid, imprisonment, healthcare, the public inquiry, emergency response, and long-term support for victims. The true total public cost of Rudakubana's crimes is therefore far higher and cannot presently be calculated from published figures. A killer who has shown no remorse. There is no established evidence that Rudakubana has expressed genuine remorse for murdering the 3 girls or attempting to murder 10 other people. Counterterrorism police said after sentencing that he had shown no signs of remorse and had given no explanation for choosing the children or the dance class. His courtroom conduct intensified that impression. He disrupted proceedings, shouted, refused to cooperate, and was repeatedly removed, rather than remaining to hear the devastating accounts of what he had done. His late guilty pleas prevented a full trial, but they did not amount to a public expression of regret, nor did they provide the bereaved families with a clear account of his motive. The attack itself was described by the sentencing judge as sadistic. Rudakubana arrived armed, entered a room occupied mainly by children, and continued stabbing until adults intervened. The contrast is severe. A killer who has offered no visible remorse will now receive care built around recovery, responsibility, and therapeutic engagement. The children he murdered will never receive another opportunity of any kind. Public backlash erupts. Prison Officers Association National Chair Mark Fairhurst accused Rudakubana of playing the system and argued that he should spend his sentence in isolation. He condemned the prospect of the murderer receiving freedoms and rehabilitative opportunities that would not have been available under equivalent prison conditions. The criticism reflects a much wider reaction. Broadmoor remains heavily secured, but words such as therapy, recovery, vocational training, social activities, and patient involvement inevitably sound intolerably generous when attached to someone responsible for murdering children. Critics including Rupert Lowe and Darren Grimes have presented the transfer as another example of a justice system that appears more attentive to the rights and comfort of violent offenders than to punishment, deterrence, and the suffering of victims. The sharpest public objection is not based on a belief that Rudakubana will walk free. It is that his daily existence may become more comfortable, purposeful, and medically supported than it was at Belmarsh, while taxpayers absorb a substantial increase in cost. The government's defense is that high-secure hospitals are not places of freedom. Rudakubana will remain locked up, monitored continuously, and liable to be returned to prison as soon as hospital treatment is no longer clinically required. That explanation addresses the legal position. It does not remove the sense of injustice. Police and agencies failed before the murders. The most damning context is the official conclusion that the Southport attack could and should have been prevented. The public inquiry found a fundamental failure by police and other organizations to take ownership of the danger Rudakubana posed. He was referred to prevent 3 times between 2019 and 2021. Each referral was assessed, but did not progress to channel support because his fixation on violence was not attached to one clear terrorist ideology. That narrow approach allowed an obsession with mass killing, knives, and extreme violence to be treated as somebody else's problem. Police, health services, educational institutions, councils, and safeguarding bodies possess different pieces of the warning picture, yet no organization assembled them into a complete risk assessment. In one particularly serious incident, Rudakubana was found carrying a knife after saying that he wanted to stab someone. The inquiry concluded that a proper understanding of his history could have led to his arrest and a search of his home, potentially uncovering his ricin preparations and extremist material before the Southport attack. The inquiry described the missed opportunities as striking and found it highly likely that the murders would not have happened if the risk had been properly managed. A danger visible across multiple institutions was repeatedly passed between them until 3 children paid the ultimate price. This move rewards failure with more public expense. Rudakubana is entitled to essential medical care, and Broadmoor is legally required to manage dangerous patients securely. Yet legality does not make the outcome just, proportionate, or acceptable to a public that has already witnessed catastrophic institutional failure. The same state that failed to protect Bebe, Elsie and Alice will now spend hundreds of thousands of pounds each year treating the man who murdered them. He will receive an integrated program of care that institutions could not organize when early intervention might have prevented the killings. His hospital detention must not dilute his status as a convicted murderer serving a life sentence. Treatment should be strictly necessary, clinically monitored and reviewed frequently, with a return to prison as soon as the legal threshold for hospital detention is no longer met. The public should also receive transparent annual figures covering his detention, treatment, and security costs. Without that scrutiny, Broadmoor risks appearing not merely as a medical necessity, but as a more comfortable destination secured through violence and institutional failure. Rudakubana will remain locked behind heavily secured doors. But the transfer still leaves Britain confronting an intolerable sequence. The authorities missed the warnings. 3 young girls were murdered. The killer showed no remorse. And taxpayers must now fund the intensive care that the system failed to organize before he attacked.